When a doctor is prescribing drugs to the patient, on the prescription sheet, you see either twice daily, or 3 times daily, or 4 times daily. There are drugs they administer 3 times daily. The doctor will write 8 hourly. And if we should follow the right order, if it is 8 hourly, it's supposed to be 8 hourly. If you are giving the first dose by 6, I think the second dose should be 8 hours after 6. You mean exactly 8 hours. And then let's say we gave this drug and it's not yet, maybe I gave this drug like by 7 a.m. sorry, and then after 2 hours, and that drug is supposed to be 8 hours. After 2 hours, the patient called me that he needs that same drug. It's just for me to explain to the patient. It's not your time for that drug. As simple as it is, some patients will understand, some will not understand. But if I should take my time and explain to the patient, if it is a pain reliever, I'll tell the patient, sorry, it's not your time for your penta or your diclofenac. But if the pain, can we buy time small? If the pain persists, maybe we'll give you paracetamol in between. So, by doing that, at least the patient knows that this person has listened to me, and the nurse is doing her work or doing his work. At least the nurse has explained why she's not going to give this to me at this particular time. Why I won't administer the anticoagulant now. I've administered it immediately after surgery. I'm not supposed to administer it now till the next 1 hour or 2 hours. So can you please hold on? Please hold on. In the next 2 hours, I will administer it to you. It's as simple as that. When you take your time to explain this to the patient, in fact, even if you are fighting with the patient before you know, you become best of friends to the patient. And the patient will want to always call you. If there is any issue, the patient will say, it's that nurse I want, call that nurse, call that nurse. So, you took your time and explained to the patient why you refuse to give this, why you are not going to give this anticoagulant now. You are giving it in the next 2 hours. You are following the prescription. But if the patient insists, it's as simple as you inform the doctor. As simple as that. This patient wants another anticoagulant now. I gave her in the last 1 hour and she wants another one and it's not yet time for another one. You inform the patient, the doctor. Since he was the one that prescribed, maybe he will come back and review his prescription and change it to a more flexible time for the patient. The patient at home that I will go and administer drugs to, I think before I get to the patient's house, I should know everything about that drug. I should know this drug is supposed to be administered how many hourly. Is it 8 hourly? Is it 6 hourly? There are some drugs that you see the doctor will write PRN. That's when necessary. PRN means when necessary. That's when necessary. Whenever you feel it's necessary for the patient, you give. But this time around, there's no doctor prescribing this drug. It's you assisting the patient at home. So, if you know the knowledge of the drug, if you have the knowledge of the drug, you'll be able to know how often you administer the drug to the patient. And one thing I always said is, patients easily get addicted to penta. If I administer the penta to you, I won't leave it with you. I will take it with me. So that the next time I'm coming, I will come with it. Because the tendency of getting addicted, if I give the patient the drug with you, is there. But if I take it, the patient will not. After all, the patient doesn't even know the drug. I only come and inject you and go. So he can't even send another person to go and buy. But if I leave it with you, he's seeing it, you carry it and give. You administer it himself. Because as you are administering the drug, the patient is seeing it. You don't even need to teach patient what you are doing. Patients are very, very wise. When anything you are doing to them as a nurse, they are watching you. Before you know, you see them doing it themselves. Especially those that stay long in the hospital. Once you are doing something to them, they are watching you. I'm coming to your house to administer penta, and I want to administer it IV. I got the vein, I pushed it. The patient is seeing it. Okay, this one that she's looking for vein like this is okay. I now left the penta with you. And maybe after 2 hours, the patient now had another crisis or is in pain. I won't call this nurse to come. Let me just give myself. After all, I saw what she did. The patient will now carry it and give herself. But if I go with it, she won't see it. She won't get it to administer herself. To administer it by herself. The next thing she will do is she will call me on phone. I'm in pain too. I will now ask her, is it time for the next dose? I know I gave you around 8. I'm not supposed to give you by 10. Can you hold on? I'll come and give you later. Please. It's not your time. And sometimes you can even go ahead to explain to the patient, if I give you this drug consistently, anytime you request for it, you get used to it, you get addicted to it, and it will affect you. It's as simple as that. That's why I said, when you talk, when you sit with your patient and talk, your patient will understand how things are, and you too will understand. Although sometimes you find difficult patient, but even at that, no matter how difficult you are, if you meet me and you must become friends by fire by force. Because I will make sure I take my time and explain how things are being done. This one, nobody is prescribing it for me to give you. I use my discretion or my knowledge of school to administer these drugs for me. I had a patient while I was in Guabalada, University of Abuja Teaching Hospital. I worked there in the surgery ward. The patient was brought with ulcer of the arm. A young lady, she was 18 then, that's 2016. And then I was so curious. I didn't even know that it's an old patient. If you see her folder, very huge. In fact, they had to open volume 2 for her. So I had to go through the folder. I now read what causes the ulcer, the whole upper arm. It's penta. She will inject herself. She will just be injecting herself anyhow. Big ulcer. That's how we had to be cleaning down. In fact, they had to invite plastic surgeons. They had to do skin grafting for her on the hand. When this lady, one day she came and met us, we were on night duty. We were sitting down, 2 of us, the nurses. She came and met us in the nurses' table and was telling us, she said, Auntie, I want to tell you something. I said, come and sit down. She sat down. She said, you see this my room? I said, yes. She said, there's no place in this Abuja that I've not gone to beg for money. I look at her, I said, when will you go and beg for money? Your auntie has money. She said, yes. I will leave her house. Or go and, if the things start doing, that's if she wants the penta, she'll go to the road. Sometimes she'll go to area 1 job, that area 1, and stay there and be begging people for money. Like the way these beggars beg for money. She'll beg money. When she gets a lot of money, she'll go home, go to the nearest chemist and buy penta and inject herself. Even when she was on admission, someone was still bringing penta for her from camp. We had to put an eye on her and make sure it stopped. In fact, the worst she did was that we didn't know how she did and got the prescription sheet, wrote prescribed penta for herself, send the patient relative to go to the pharmacy and get it for her. When they came, she will tell you she's going to the toilet. She went to the toilet and injected herself. We have to become police in that world. Anytime we see her going to the toilet, we follow her behind. If not, she'll go and inject herself. But it's because she was already addicted to it. That's why. I didn't know whether it was at home she got used to it or it was in the hospital. But for the person at home, that I will administer the injection and I will leave it with the patient. The patient will get addicted to it. But I have a different scenario. my late niece that died 2019 as a sickler. When I was schooling in UJ, I was staying in their house. Once the crisis started, she called me, I'll run and come. She tell me, check that container. There's one drop there. She's always having penta with her, but she has never injected herself. She tell me, please inject me with this one. I'll look at her, She'll say, please. I was a student then. I wasn't even licensed to do anything. But I was looking at her condition. I will do that. I will carry it. I will inject her. I will discover that before you know, the next minute, if I come back to her room, I'll see her sleeping. I had to force her. We must go to church and open for her. Because then it was being she used to go to. I told her, I said, we must go to church. So that all these administering drugs on our own will stop. You know, I'm not licensed to start administering drugs like that. Not even a drug like this. It's a controlled drug. Ordinarily, it's not anybody that's supposed to administer this type of drug. It's only a registered personnel that's supposed to administer any controlled drug. All the morphine, codeine, penta, tramadol. Students are not supposed to administer it. I told her, I said, it's because you are my own. And if you catch me, I'm in trouble. Please. She has never, till this lady died, I've never seen her administering penta. But she's always having one penta in her container. And I learned something from her. So, that's what we always do. And then I had to insist that we must go to hospital. Go and open folder in Jude. There are specialists there, they will see you. And then they will start treating you. And that was it. She became Jude's patient. Because every time she would say, come and administer penta, I'll be sleeping late at night because we're not sharing room. My own room is different from hers. I'll be sleeping at night, I'll see her call. Once I just see her call, I don't even need to pee. I know something is happening. I'll run to her room. What is it? She'll say pain. But I've never seen her administering that drug to herself. Once this girl is okay, if they tell you she's a sickle cell patient, you won't believe. She will do her guide. Go for her yawo that she wants to, anywhere she wants to go to. It's only when crisis starts that you know that this lady is a sickle cell patient. And she's a strong patient, very strong lady. The day she died, I couldn't hold it. She had some complication that we had to do surgery for her. She ended up in ICU. I went to see her in ICU that day. Me, I just came to they told me she was on admission, went to Jude. Entered ICU with the help of one nurse, because then I was not in Jude. And then saw her. She was on life support, almost going. Stayed with them. I got home, just like 30 minutes I got home. I just said, let me call them and find out what they are doing. Her younger brother just got the news and she just died. But one thing I learned from her is she has never gotten addicted to any drug. Whatever drug you give her to take, sometimes I'll be the one that will be disturbing her. Why are you not taking your drugs? Once she's better, she forget that she has drugs she needs to take. If you go to her room, you see folic acid, plenty. I will sit with her and start talking to her like a small girl. This person I'm talking to is not a small girl. This is somebody that is senior to like just 4 years, so we are peer group. We're peer mates. I will ask her that, why are you behaving like a small child? See a lot of folic acid, some of them have even expired. Once she goes to hospital, we give her drugs, she feels better, she dumped them. Maybe that's why she didn't get so attached to the analgesic that she didn't even get addicted to them.